everybody. Okay, I kind of walk around a lot. First of all, is this thing on? It's on? Okay, beautiful. So I find it hard to just stay stuck to something. I was one of those kids, on a road trip, moving around everywhere. I feel so welcomed being here with you absolutely amazing people, from educators to students. My mom was a nurse, so it's a special place in my heart. So I'm not great with this. If I don't follow this, just look at me. I've got 6 patients. 4 call lights are going off, and if it's not charted, it's not done. I'm sure you've heard that. Floor nurse, bedside nurse. Students take note. Or how about, it's my signature on this thing. If the dose is wrong, I could be held liable. CRNA, NP. Or how about if the TJCs go down? If they drop while the patient's experience is already down, it's on me. Director, CNO. I think I got these right because I've heard these from stories from nurses. But the point is, all nurses, nursing students, educators, different roles, different responsibilities, different stressors, same impact. Stress. And I know we've covered a little bit of that before, so I'm not going to cover exactly what these wonderful people said. I'm going to cover one little thing, and that is habits. I was going to bring you habits, because I'm a habit coach, and I work with people in their self-care habits, their eating habits. How much are you in the habit of eating? What are you in the habit of eating at work? How are you in the habit of eating at work? Got 5 minutes? I was going to cover little tips, but you know what? I've been really moved to bring you one thing that has really been catching my eye in the past couple of months with clients and with research, and that is one tiny action. One action that is so tiny, it's doable, and it is so huge in its impact. Keep an open mind. It's the micro habit of human connection. That's really been hitting my heart. Now bear with me. I was inspired through my work and with my client. I've worked with companies, mid-sized companies, and one hospital, I live in Los Angeles, with incentive programs. They're great. You keep certain health metrics up, or you hit certain health metrics, such as you stop smoking, you lose weight, whatever it is, and you get more deposited in your HSA, or you get a discount on your insurance premiums. Wonderful. Health and wellness programs, WellHub, a lot of them, they're great. You get to join 30-day challenges. They give you portals to go online and look at these diets and join programs. You get discounts at local gyms. Those are all wonderful. I advocate them. Thing is, this is where I get clients. These companies bring me in. 24 Hour Fitness brought me in, one of their local ones, because you get these wonderful hacks and programs and they fizzle. Why? Because you weren't in the habit of doing it anyway. And it takes more time outside of work. So yes, self-care habits, needed. Eating right, sleeping, all that. So that's what I help people with. But instead of bringing you the tips, you can go to ChatGPT for that. You can get coached by me, but you can get the list. This is the human connection habit that becomes a part of you, and you don't do it outside of work like you do with the wellness programs and the incentives. You don't go to the gym afterward, or you don't work on it during work. It's another thing to do on top of your charting. This is just part of what you do as you get on with your work and your business. I have a client named Sandy. She's a nurse, a longtime nurse. That's her real name. She said use it. She works in Northern California. And she was sharing with me a few months ago about, Ronnie, I'll never forget how she was describing it on Zoom. It's amazing to me how we walk around the hospital and people walk right by each other in the hallway and don't say hi. And no shade to students. I'm like, oh my gosh, I'm going to talk to students. She said the younger nurses are always on their phone and DMing each other and texting. And there's no connection. I don't know, maybe because we're focused on the task at hand, we're all up in our heads, we're busy, we're stressed. And I was thinking, you know what? I kind of see this in society as a whole. I started testing it out. Oh my gosh, I'm even testing it here. it is hard to say hi to people and make eye contact and keep it more than a glance or get off your phone. So anyway, she took it to her unit. And at first she got some pushback. She was telling them, you know, if it doesn't have to be charted or documented, you have a question, whatever, don't get out that computer and send a message. Walk down the hallway and ask. Or text. Don't text. And she got pushback. So I was like, you remember Sandy, the hallway hi? I'm sorry. I'm not sure if I'm cutting it out. And she said, yeah. I'm like, start there. Okay, they thought it was a joke, but they love Sandy. She's their leader. They went along with it. The thing was, when they walked into a room, the break room, the cafeteria, walking down the hallway, make a little bit of eye contact. I told her that was key. And smile, quick smile, hi, or at least a nod. And it must be not neutral, because two things happen. When you hold eye contact with somebody, right now, for more than 3 seconds, you have safe or danger, fight or flight. Neutral can be, depending, you know, with the B face, some people may think it's danger. So you have to have a good demeanor. She did this for about 3 weeks, and when we talked again, she goes, okay, Ronnie, I gotta tell you, there's a better vibe in my unit. And I don't have proof, but I'm telling you, I'm a witness. There's a little bit less stress. Proof, key word. I'm like, there is proof. One of my favorite, I don't know if this slide shows, not really, oh, not gonna hit it yet. One of my favorite studies was a non-academic study. I loved it. 2 years ago, maybe you've heard of it, in 2024, it was conducted by the Happiness Project, Dr. Laura Santos. And she asked a group of workers, nothing to do with healthcare, as you're walking into your building, you see somebody in the parking lot, make eye contact and hold it, say hi, the nod, the smile. As you're walking into the lobby, into the company, so you could do this at the hospital. As you walk into the office, over the cubicles, make eye contact, say hi. As you're walking to the bathroom, whatever it is. But you must have the eye contact with a good demeanor and say hi or nod, smile, something. So there was only a group that was in on it. They did this for a week. The following Monday, actually it was a Wednesday, after 7 days, they surveyed the entire office, and they worded it in such a way so they weren't giving anything away or kind of pulling in answers. There were a lot of questions about different things. She was looking at happiness at work, not just job satisfaction, which a lot of companies are bringing in programs to see happiness at work beyond job satisfaction, actual joy, enjoy. And what came back was that the coworkers that were not in on what was going on were actually approaching other people over the cubicle, whatever, and offering help. Hey, you want an idea? Hey, I thought of this. Hey, you know what? There was a little bit more collaboration in the survey they took. A lot more communication. And definitely more connection. And this is what she noticed, which caught my eye. There was less stress. Everyone across the board noticed, you know, there's been less stress lately. Interesting. That tracks. She took this to her academic colleagues and they said, yep, they got the dose. When you hold eye contact with a good demeanor, for 3 to 5 seconds, you get an instant hit of dopamine, oxytocin, serotonin, and endorphins, the happy hormones. Dr. Laura Santos, love that. She is in the happiness lab. Now, I'm not going to hit that yet because I'm going to explain. Before you think, okay, Ronnie, that's nice. Happy, happy, joy, joy, look at each other, say hi, your ease is gone. No. And yes. This human connection, tiny little micro behaviors at work, is pragmatic. I am far from woo-woo. I know a lot of people think coaches, especially life coaches, are woo-woo. I did before I became a coach. I am pragmatic, and this is pragmatic, and more importantly for you and for students getting into it, it is serious. Medical malpractice investigators from Strico, hope I said that right, showed that vital communication failures directly contributed to or led to 40% of the malpractice lawsuits last year, 2025, in US hospitals. That was nearly 2,000 deaths due to communication. not something else. And the majority of this, for the most part, was the lack of communication amongst healthcare providers, not healthcare providers to the patients. So the physical therapists, the pharmacists, the doctors, the nurses, everyone included. Now, Psychro insures, they're the insuring company for Harvard hospitals. So Harvard got a hold of this, and they decided they wanted to hold conversations, not interrogations, not interviews, but conversations, which just finished about a month ago. Now, I have pulled out the section where they conversed, they talked with nurses. And I had thought, before I read the outcome, was fear. Now, fear can cover a lot of things. You're not directly afraid to speak up or communicate. Oh, Psychro, let me go back a little bit. Psycho showed this, unfortunately, as a typical case. I say unfortunately because they said it was typical. Just to give you an example. There was a gentleman, he had surgery, and post-surgery, he was complaining that his stomach hurt. She took care of him, as you would. She didn't tell the surgeon about the abdominal pain. It turns out this gentleman had a low red blood cell count, which you guys know better, you're nodding. This is indicative of internal bleeding, and he died of internal hemorrhaging. Now, that may or may not be directly what caused him to die. However, case after case, it was something that was unspoken that may have pointed to that, to something. Again, nearly 2,000 deaths. So that's what I mean by it's serious and it's real. So Harvard took over, and they had conversations with nurses, and they determined that these communication failures was not because of not being competent, far beyond that. Not because you're not educated, not because they were not well trained, not because of any of these, being overwhelmed, understaffed, none of those. It happened in moments, just a moment of acute pressure and stress. Now, I will tell you, in my studies, at work, and it may be the same at home, it may be different depending on your personality, but at work, there's a baseline communication pattern. Everybody kind of defaults to it, right? Water meets the level of water. So if you lack these tiny connections, when there is pressure, acute pressure, your brain goes back to that baseline communication. And if your baseline communication pattern is not to say hi when you're walking by somebody in the hallway, or you barely nod, or you don't, you barely glance, then that's where the brain goes to in acute times. And I'm not talking about in the ER or ICU. Those were included, but that wasn't even the large context. They were just in moments where you didn't think of something, you were under stress, or acute pressure, and you didn't speak up, you hesitated. And this is what came from the conversations with nurses. In their conversations, their real emotions showed. Lack of rapport, that tracks. If you're not building these tiny, tiny little connections during the day when there's not that much pressure, you always have pressure. You always have a little stress. But if you're not building these tiny communication connections that build the trust, then you may lack rapport. There were hierarchy barriers. Rotating staff, I can see why you can lack connection there, because there's different staff all the time. You don't get to know them. Lack of trust was huge. Cultural silos that exist. I'm from LA. A lot of Armenian nurses, a lot of Latina nurses. I'm sorry, I'm Latina, but I will tell you, come on, we're tribal. Sometimes we speak to our people. You know that, okay? We all have biases. It's not a bad thing, it's just a fact. There are cultural silos. Assumptions based on the role. Now again, we have all these wonderful programs and hacks in place, and yet last year, it didn't get that much better since 2021, post-COVID. Stress and burnout together is the #1 complaint nurses have about the job, not the profession. You love your profession, we can see that. I mean, I assume that you're here, but it's about the job that can wear you down. So before I invite you to do something, and before I wrap up, I do want to tell you, I was going to bring you a whole list of little things you could do at work to ease your stress, little exercises, literal physical exercises, little eating exercises, little self-care exercises. And I was really afraid to bring you this one tiny micro habit of human connection because I thought they're going to think this is so minute with all you wonderful educators here, your academics, your professors here. But as you can see, it really, really affects the workplace. Connection, and that must be practiced. I'm all about repeat, repeat, repeat. That's what makes a habit, especially a micro habit. And you can do it. And it's not that easy. So I'm going to give you a gift. Maybe it's up here yet. If you want to scan the QR code, it's just a gift. It is a process, a 4-step process on how you create a habit. I hope mine works. if not, approach me later. But it is a process. It's not the one-on-one coaching, the 3-month coaching, but it is the steps of how you actually create a habit. So if you want to talk about your habits, you want to think about something you want to create, then you can get a hold of me, and that's yours for free. You want to talk, it's free. You get a free call, okay? Because I didn't give you that. What I would like to do is give you an invitation to today, and I mean today start, because it's going to get harder when you go back to work. Tomorrow at the conference, when you go out to dinner tonight or drinks. Drink? No. When you work out tonight at the hotel gym, whatever. When you fly back at the airport, and then when you get back to work. Do the hallway hi. When you're walking by, get off your phone, make eye contact. But I will tell you, 3 to 5 seconds, they're going to think you're weird. 1, 2, that's good enough. I'm telling you, I walk into the gym, I teach senior fitness at 2 gyms, and when I walk in and somebody opens the door, I literally have to go, hi, or thank you. When I walk in the front desk, everybody's like, hey, how you doing? They're still looking at the computers, checking people in. Now they don't know what I'm up to, but now the front desk people are starting to actually look at me. My seniors who I teach, they know I'm in a better mood. They don't know why. They're like, everything good at home? And it's just because I'm in a better mood there because I go in and I'm making eye contact with them during the class. But it's hard. On my way here, no one at the airport held more than a glance. They're nice people. They're working. They're busy. I get it. But it's hard. So start practicing now because you do this every day. A habit is something that when you do consistently on a daily basis, repeat, 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 it becomes a habit. And there's no such thing as build a habit in 21 days, build a habit in 30 days. It's all marketing, okay? It can take anywhere from 56 to 185 days, okay? I promise you. You must repeat. I will do this at this time. If I'm walking down the hallway, if I'm working in the work room, I'm going to make eye contact with somebody. It must be you decide, I do this at this time, and repeat. So I invite you. That's my invitation to you. And again, I was kind of scared. I threw out what I was going to do like 2 weeks ago. I said, no, I'm going to bring this human connection. Because I'm telling you, I grew up with a nurse as a mom, a doctor as a dad, dentists and doctors in my family, aunts, uncles, all that, all surrounded. When people heard, oh, my mom's a nurse, people were like, oh, it's so impressive. When they looked at her, people think nurses and no nurses are intelligent, educated, on it. They're the warriors behind the doctors. You know the new technology, all of that. You're more than competent. People just hold you in high regard. But more importantly, and you've heard it today, empathetic, and the big word that you're going to hear the rest of your nursing life, compassion. Because it's how you make people feel. It's more than just treating them. It's how you make people feel. You, nurses, nursing students, professors, everyone in the nursing world, you are literally the embodiment of human connection. And for that, I thank you. Now take it on. And what better than to do something simple for easing your stress? Thank you, guys. Do you have any questions? No? How are we on time?
On this road to becoming a life coach?
Well, like I said, I was cynical at first. Thank you so much for asking that. I was a personal trainer, and then COVID hit. Bing, bam, boom, went on Zoom. I'm like, oh, God. And it worked. But I had people asking me, I have a friend or my sister or my boss, they're not working out. So I'm like, well, do you want me to talk to them? So we'd get on the computer, and it was never about, I'm too busy, literally because of time. They were at home working. But to answer your question, I would find out what the real problem was, and I was talking to them. And I talked to professionals, C-suite. They weren't taking care of themselves, fitness, eating, self-care, because there were anxious times. They pulled their big girl pants up, but the kids were working off the dining room table, their partner was home. They didn't want to work out with their husband at home. I'm like, really? I mean, you impressed me. So I would find out how to help them, not just set boundaries. Hey, mom's going to work out at this time. Also get off that computer at 9 at night, because if they were bosses, they were responsible for the teams, or people who were team members didn't want to get furloughed or laid off or whatever. So I started talking to people, and people said, you really coach me well. You should really be a life coach. And I'm like, what the heck's a life coach? But, okay, fitness coaching. So I've evolved. And in coaching people, I finally took it seriously. I became ICF certified. I've moved up in the levels. Every time that we set whatever it was, time management, productivity, self-care, plan of action, okay, don't overstep. Don't surf over that surfboard. One tiny action. Just do that to progress you to your goal. Every day, repeat. I always brought in what I did as a personal trainer. I didn't care if people worked out for 5 minutes a day. Same bad time, same bad channel. Just, yes, I'm aging myself. It's more important that you show up every day and do it. Repeat makes a habit. And then the algorithms, I guess, were working. I kept seeing habit coaching, and I found out there's such a thing as habit coaching, and I became a certified habit coach. So thank you for asking. All right, well, thank you for your time, and I would love for you to see you guys make eye contact through the day. Thank you.